Hi, I'm Amy, and this is my presentation on the reduction of lateral scoliotic curvature in adolescents through a hybrid treatment program. Adolescent scoliosis has become one of the most chronic adult population diseases if it's left untreated. We see three major forms. We see lateral scoliosis, which is an S curvature from your cervical to your lumbar spine. You have kyphosis, which is a C-shaped curvature from your cervical to your thoracic, and lordosis is a C-shaped curve from your thoracic to your lumbar spine. These all have an effect on the wellness of life, how people function, their pain, and the way that they are able to correct their posture from a day-to-day basis. There are two forms that are commonly used today, which is corrective bracing, that is more often seen in young adults only because it is to correct posture as you grow, so it forces you to strengthen the muscles while performing certain tasks such as sitting at a desk, playing at recess, or walking around. Physical therapy is more often used for our adult population once they've already finished growing and they don't have to correct their posture. They have to strengthen other muscles so that way they can continue to function normally. So as we can see here in the far left picture, this is someone with lordosis. Instead of the spine being relatively straight, you have an anterior tilt of the pelvis and the lumbar spine curves in a C shape. The middle picture is a classic kyphosis photo. You have rounded shoulders, neck is leaned forward, and it creates a C shape in your cervical and thoracic lumbar spine. The picture to the far right is someone with lateral scoliosis. You can see the S shape from side to side. This is the one that we will be focusing on when discussing our project, just because this is the one that has the most detrimental effects if it is left untreated. So the point of this study is going to be to reduce the scoliotic curvature in the adolescents, to reduce their pain and increase their ability for function, and then combining multiple types of treatment for optimal results. And the hypothesis is creating a hybrid program that combines bracing and strengthening exercise will optimize the reduction of spinal curvature in adolescence as well as the decrease of long-term effects into adulthood. The picture to the upper left-hand side shows a man who has kyphosis that has been left untreated. Some potential struggles that this individual might have is reaching above his head for a cup out of the counter or sitting up at a desk for very long. He does not have the strength to uphold that, so he's constantly leaning forward and has no muscle strength to hold him up. When people have rounded shoulders, they also lose motion in their shoulder blades. They lose motion in their neck, which is used for things like driving, for putting groceries away. Just very daily tasks can be much more difficult if you have this disease left untreated. Also, their center of gravity will be off because they're bent over instead of standing up tall, so there is an increased likelihood for falls in an elderly population with scoliosis. The picture to the right is a little child who is using a corrective brace. So what this is it's a very bendable brace that they can put on. They basically wrap it around the back almost like you would a jacket. It velcros up in 3 places in the front, and it holds the child in an optimal posture while they're doing things like crawling, walking, sitting, playing, anything like that. So it trains their muscles what should be the correct form that they should have. The relevance of this disease to physical therapy is that 30% of the population that comes to physical therapy is solely due to back pain. Of this 30%, 75% of the population has a form of scoliosis that has not been treated or was not treated sufficiently. 4 million adolescents have scoliosis in the United States. That is a large contributor for an increase in adulthood population of back pain. If we can treat the disease at a younger age, there's going to be a decrease in the amount of people that we will be seeing with back pain in adulthood. The importance of this is to overall benefit a large group of patients. It will treat their current symptoms, but it will also improve their long-term benefits, their quality of life, and the things that they're going to be able to achieve. It also is beneficial to the scientific community because it will open up other avenues for treating other diseases, other conditions, combining other forms of sports performance or rehabilitation. There are 2 different treatments that we will be combining in this program. Each of them have limitations and each of them have ideal outcomes, but combining them together will provide the most optimal outcome for long-term effects. If we see positive results to this experiment, there could be a potential for combining PNF patterns, prevention strategies, strength and conditioning techniques, and other sports performance techniques that would be beneficial in aiding someone's rehab or aiding someone's performance. Like I said before, there will also be another avenue for treating other diseases. Strokes and Alzheimer's are genetically linked diseases that require preventative measures at an early stage if you know that you have it, or if you don't know that you have it and are diagnosed with it, there's a lot of treatment that you have to undergo after you've been diagnosed or once your disease gets to a certain severity. If we can combine techniques that will prevent it and treat it at the same time, the likelihood that there would be a decrease in the population who suffer from this would be beneficial. Another disease that would probably be helped by creating a hybrid program is multiple sclerosis. This is genetic and this is a very progressive disease. So if you can treat the symptoms when they start and then create a preventative exercise or a preventative strategy to reduce the effect that it'll have long term, that'll benefit another large population of people. The idea for this is directly addressing the cause, which is the curvature of the spine, but also addressing the functionality and the pain that individuals will be feeling. Creating this hybrid program is innovative in the fact that it is thinking long term while also providing very aggressive current treatment. And usually you see people who want to do aggressive treatment when they are diagnosed with something or when they put it off and then they have to do rehabilitation because they did not treat their disease or their condition immediately. So how would we go about testing for this? We would have 4 groups. Each of the groups would have 10 individuals from ages 10 to 15 with lateral scoliosis, so the S-shaped curvature that we saw previously. And another stipulation is that they could never have received treatment prior to this. The first group will be a control group, so there will be no treatment given. We'll just be measuring how their curvature changes over the span of a month. The second group will be a group who receives the brace treatment. So for 20 hours a day, they will be in their brace doing everyday activities. The only activity that they won't do is if they play sports. Physical therapy is the third group. This group will go to physical therapy sessions 3 times a week and then do their exercises at home every other day. The fourth group will be a hybrid group. This group will go to therapy twice a week while also doing their exercises daily. They will be in the brace for 16 hours a day, excluding exercise. The way that we're going to compare the before and after measurements of their curvature is through x-rays. This will be taken prior to any type of treatment, and then it'll be taken immediately after the treatment is over. Another form of measurement that we will be using is a scoliometer. This is a measurement tool that will measure the shift in the vertebrae individually. So what you do is, as you can see in that picture, you line it up with their spine, and it'll tell you if it shifts from side to side. It'll tell you what degree of rotation that vertebra has and what side of the body it goes to. So you would start at the base of their neck and follow all the way down to the top of their hips. So you would be able to measure consistently your cervical, your thoracic, and your lumbar spine. Overall, looking to see a reduction of the curve over a month. Even though a month is a very short time, if you can see a reduction, there would be a likelihood that there would be a reduction of it over a longer period of time. So just seeing a halt in the curvature would be improvement. Another way that we'll look at this data is by having all the participants go to the same doctor prior to the treatment and after. So this way there's consistency in who is measuring their curvature and how it's being measured and who is analyzing their progression. Some doctors can vary on their measurements with a few degrees, so this would just eliminate any potential variation of this data. Precautions to know about when doing this exercise would be that these are children, so they are a higher risk category. We are going to ask the participants to wear the braces for X amount of hours and to participate in their physical therapy programs at home. However, we will not be monitoring them 24/7, so you would be based off of their honesty. So if they lied to you and said that they were wearing it, you would get different results than if they really were, or vice versa. Another thing is boys versus girls. Sometimes maybe boys are more active, or maybe girls grow faster, or there's some genetic variation that could happen between boys and girls that would need to be accounted for. Or you would have to do a group that was evenly divided between 5 girls and 5 boys for each of the 4 groups. Another high risk factor of this study is that there are x-rays that are going to be done. This is considered a little bit higher risk than normal just because x-rays can have potential injuries over a long time. However, because this is only going to be done twice over a month, it should be okay. There shouldn't be any damage or precautions related to this. However, if this was something that you were going to try to extend into a long-term study, you would need to consider a different form or just go to the scoliometer for your measurements if this was going to be a 6-year-long, 3-year-long program. These are my references. Thank you.